Today, I'm going to discuss off and dyskinesia and how they can impact the day-to-day lives of patients living with Parkinson's disease. I'll also present some strategies for identifying off and dyskinesia. Off time is when levodopa is no longer providing symptom relief. The patient has a reemergence of Parkinson's disease symptoms. Patients may have trouble with balance, performing tasks, or just getting out of the house. They may be able to shower, get dressed, and leave home, but it can take much longer, and there's a risk for falls. Dyskinesias are a side effect of dopaminergic therapy. They manifest as involuntary, non-rhythmic, purposeless, and unpredictable choreic movements. Again, they might be able to perform tasks, but they may be constantly moving, so it takes longer, and it makes life much more difficult for them. Good on is on time without troublesome dyskinesia. When patients are on, they can perform their daily tasks quicker and more safely. They have more time to do what they want or need to do with fewer interruptions. What really sets GoCovery apart is that it's the only medication proven to reduce both off and dyskinesia in patients with Parkinson's disease.
Important safety information and uses. Do not take GoCovery if you have severe kidney problems. Before you take GoCovery, tell your doctor about all your medical conditions, including if you have kidney problems, have a sleep disorder or daytime sleepiness that includes unexpected or unpredictable sleepiness, or falling asleep, or take medications to help you sleep or that make you drowsy. Drink alcohol. This may increase your chances of becoming drowsy or sleepy while taking GoCovery. Are experiencing mental health challenges, such as suicidal thoughts, depression, or hallucinations. Have unusual urges including gambling, increased sex drive, compulsive eating, or shopping. Are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. GoCovery may harm your unborn baby and can pass into your breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your doctor if you take medicines like sodium bicarbonate, or have had or are planning to have a live flu, influenza, vaccination, nasal spray. You can receive the influenza vaccination shot, but should not get a live influenza vaccine while taking GoCovery. While taking GoCovery, do not stop or change the dose of GoCovery before talking with your doctor. Call your healthcare provider if you have symptoms of withdrawal such as fever, confusion, or severe muscle stiffness. If you took too much GoCovery, call your doctor or go to the nearest hospital emergency room right away. What should I avoid while taking GoCovery? Do not drive, operate machinery, or do other dangerous activities until you know how GoCovery affects you. Do not drink alcohol while taking GoCovery as it can increase your chances of serious side effects. What are the possible side effects of GoCovery? GoCovery may cause serious side effects, including falling asleep during normal activities. You may fall asleep without being drowsy or without warning during activities such as driving, talking, or eating. This may result in having accidents. Your chances of this while taking GoCovery are greater if you take other medicines that cause drowsiness. Tell your doctor right away if this happens. Suicidal thoughts or actions and depression. Tell your doctor if you have new or sudden changes in mood, behaviors, thoughts, or feelings, including thoughts about hurting yourself or ending your life. Hallucinations. GoCovery can cause or worsen hallucinations, seeing or hearing things that are not real, or psychotic behavior. Hallucinations can be a serious and common side effect of GoCovery. Contact your doctor if you have hallucinations. Feeling dizzy, faint, or lightheaded, especially when you stand up. Orthostatic hypotension. Lightheadedness or fainting may happen when getting up too quickly, especially after long periods of time when first starting GoCovery or if your dose has been increased. These side effects are serious and common for GoCovery. Contact your doctor if you experience these. Blurred vision, eye pain, vision loss. Tell your healthcare provider if you experience changes to your vision. Unusual urges. Examples include gambling, increased sexual urges, strong urges to spend money, binge eating, and the inability to control them. If you notice, or your family notices, that you are developing any unusual behaviors, talk to your doctor. The most common side effects of GoCovery include hallucinations, dizziness, dry mouth, swelling of legs and feet, constipation, a drop in blood pressure when standing, and falls. These are not all the possible side effects of GoCovery. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. What is GoCovery? GoCovery, amantadine, extended-release capsules, is a prescription medicine used for the treatment of dyskinesia, sudden uncontrolled movements, in people with Parkinson's disease who are treated with levodopa therapy or levodopa therapy with other medicines that increase the effects of dopamine in the brain. With levodopa and carbidopa in people with Parkinson's disease who are having off episodes. It is not known if GoCovery is safe and effective in children. Please see patient information at gocovery.com.